Hi all, this is Dr. Demchenko, and today I'm going to tell you what to do if you sprained your ankle. Of course, first of all, when the situation is acute, when you can even see a hematoma in the area of swelling, it is necessary to visit a trauma center. Take an X-ray, see whether you have a complete ligament tear or a bone fracture. After that, you need to take urgent medical actions. That is to cool down the area. Raise your leg above your head in a lying position. Apply a tight pressure bandage and then, after a few days, go into, let's say, subacute phase. And the problem is that very often when the swelling goes down, when the basic pain from the tissue undermining goes away, and the situation should seem to be getting better, there are still walking pains remaining. Today, I would like to talk about just such cases when the ankle does not heal well and hurts for a very long time after the sprain. What causes it? Most often, it's because the bones in the ankle joint shift during a sprain, and that shift prevents the joint from functioning properly. Most often, it is a walking pain on the front surface of the ankle joint. In order to check whether you have a misalignment that prevents you from walking, running, and jumping normally, you can perform a fairly simple test near a wall. In order to take the ankle flexing ability test, we will need a ruler and a marker. We measure off 10 centimeters from the wall and put a small mark. Next, put your healthy foot on the mark and, without taking off your heel, reach your knee to the wall. Normally, you should be able to reach and feel a slight stretch along the back of your shin. Next, place your sore foot on the same mark and try to reach. If you feel restriction or pain along the front surface of the knee joint, here or here, it is very likely to be a joint problem. And if you do the following exercise, your walking pain will lessen or disappear. If you get a positive result on the test, that is pain in the anterior region of the ankle when bending, we can try this procedure. It is absolutely painless and safe. In a large percentage of cases, it can help you well from pain. How is it performed? As the most common problem of bone displacement in the ankle will be the head of the fibula shifting forward, the procedure to eliminate the pain will be trying to bring it back to its normal direction. How do we do that? Tenor, this part of the hand, we place on the head of the fibula, with the fingers resting on the heel bone. Then we do a squeezing motion with the hand. A light one, about 1.5 to 2 kilos, like this. It shouldn't be painful, but quite comfortable. We squeeze a little, and while maintaining the compression, we move the knee forward and bend the ankle. If you've done it right, the ankle flexion should go easier and the pain should decrease. How to perform this on yourself. Place the tenor on the head of the fibula to grip it, not the entire ankle. Hook on with the tenor. Second step, put your fingers on the heel bone like this. Third step, use your hand to move the bone back a little bit, and start doing the ankle flexion movement. Repeat 10, 12 times in 3 approaches per day. After such mobilization, be sure to check whether the flexion has improved and whether the pain during the first test near the wall has decreased. Normally, after the first approach alone, you should already have a few centimeters more in flexion and less pain. Also, a very good sign will be the transition of pain from the front of the ankle to an even tension on the posterior surface of the shin. Do these exercises 2, 3 approaches a day of 10, 15 repetitions. Sometimes you need to do them for a week. I hope your ankle pain goes away and your good mood returns. See you all again. Bye.